Good afternoon, everyone. Sorry about that. That's right, I was checking to see if you were on the bit. Good afternoon, everyone. Bonjour tout le monde. I'm pleased to be here today, joined by Lanette Siragusa, a face and a name that is familiar to all Manitobans. As many people know, Dr. Brent Friesen is away this week, taking some very deserved time off. Him and all of public health and system leadership for their continued excellent service to the people of Manitoba during COVID-19. Just a reminder that going forward, we're going to be doing this one COVID-19 briefer each week. This would normally be on a Monday, but because of Monday being a holiday yesterday, we're doing our Monday briefing today on Tuesday. The amount of COVID briefings, we would also say, may increase or decrease depending on the need, depending on the evidence. And again, this is in line with what our other provinces are doing. We're trying to endeavor to do our utmost to give Manitobans good information, to give them timely information, to let them know what's going on, because it affects all of us and we need to know. And so that is why we are here today, and that is why we will continue to be accountable to Manitobans. Keep in mind also, though, that on the days when there isn't a briefing or a presser like this, Manitobans are still getting that good information, daily bulletins, and on the weekend there are more social media updates, and we'll continue to monitor that and to adjust it to get it right. Manitoba recently saw an increase in the number of COVID-19 cases, and our first COVID-19 related death in nearly 3 months. So it's been a significant bit of time that we've had in these last few days. We know, and we've all seen the impact that COVID-19 has had worldwide since the start of this year. Even in our province, when compared to others, we've seen relatively low numbers, and we want to continue to see relatively low numbers. As Brent Friesen continues to say, we have to learn to live with the virus. We have to learn to live with COVID-19. It will be here for quite some time. But I also know that when I say this, many Manitobans will be perking up and say, well, this last weekend we had some very significant numbers. Why does the minister suggest that the numbers are relatively low? And so I want to acknowledge that when Manitobans got up on Saturday of this long weekend and saw 18 new cases, that would have come as a surprise. That would not have been something that was expected to them. Yeah, we saw numbers as high as that in April, but we had not seen any number like that recently. So we have seen some higher numbers. We have, and we want to speak to that today. I know that Lanette Siragusa is prepared to also qualify those numbers and give Manitobans more detail around the numbers of this last week. I want Manitobans to also remember that public health is investigating, that they have that responsibility. Once there is a positive lab result, they're doing the follow-up. They're doing the investigation. They are reaching out to find out who has had contact with this individual, who are the people who need to be contacted as a result, who needs to be sent home and asked to comply and stay home in order to keep others safe. And while we talk about the compliance of Manitobans being a key ingredient in the recipe that has made Manitoba a relative success story, one of the things that Manitobans are doing best is that compliance. And I want to say that public health case contact that's going on is successful because Manitobans are responding. People who have COVID-19 are being very good about indicating who are the people they've had the most contact with, and those people are getting contacted. So all along this chain, the right things continue to be done by Manitobans. So Manitobans, thank you. Case and contact management occurs every day of the week. It is led by public health nurses and public health physicians. So let's start off where most people are thinking today. This last long weekend, we had 27 cases reported, including then 18 on Saturday, 6 the next day, 3, I believe, for today, but I don't want to take the message away from Lanette Siragusa. I indicate that in order to say that we have seen a decrease in the last few days. 18 was high. But I want to make clear to people that right now, out of those 27 weekend cases, almost every one of them continues to be understandable. In other words, it's epi-linked. It is continuing to be spread throughout, let's say, one household or spread throughout close contacts. So that's an important point to share. When public health investigation identifies settings where COVID-19 transmission is a risk, these settings are communicated publicly. I understand that people are concerned as well today if they live in and around the community of Steinbach, because on the weekend it was reported that there were 2 cases positive in Steinbach. And both were related to restaurants. So that, I think, has a lot of people wondering what's going on. And even this morning, we learned that there were some restaurants, out of an abundance of caution in Steinbach and other businesses, choosing to close. So this presser gives us a chance to speak to what is going on there. And I want to make clear that people have a desire for information, and we need to provide it. So I want to say that when it comes to Steinbach, these cases are related. They are all from one household. These are close contacts. This is not the case that these instances are unrelated. They are related. And so on the basis of that, I think people will understand that it's still appropriate to move about the community and conduct your business and go places. If it were otherwise, we would be clearly saying so today. The most important information that I can continue to give you as the health minister is that we need to continue to stick to the basics. And I know it's redundant, and you've heard us say it from these microphones so many times, but it's the little things that are the big things, the washing your hands frequently, the maintaining 2-meter distance from other people, practicing that good hand hygiene at all times, and staying home when you're sick. Those are the things that will make the biggest difference when it comes to preventing and reducing the spread of COVID-19. Something else I wanted to say, because it's Tuesday following a long weekend, is I know when people hear today, well, 3 cases today, but was that related to the long weekend, and were they doing less testing this weekend? And that's not the case. So I can tell you that on Saturday, there were 1,354 tests that were processed at the lab. 1,090 on Sunday and 1,034 on Monday. That's a very significant number of tests to have them above 1,000 on all those days. And so I want to thank those people who are directly and indirectly involved in getting those results out the door every day. That's a key piece of our work, and it's very important for us to be able to maintain those testing levels to keep Manitobans safe. We announced Phase 4 of our Restoring Safe Services Roadmap last week. It's part of our Restart Manitoba program. And many people know that there were some things that had been proposed that we acted on. There were some things that we proposed that we didn't act on at this time because of the conditions. And there were some things that we proposed that we modified before we put in place. Just a few highlights, of course. We know we're now approximately 1 week into the additional lifting of restrictions for people to be able to visit their loved ones in personal care homes. We believe, and it's being reported, that this ability to designate 2 persons as caregivers and then allow them to have unfettered ability to visit their loved ones is working, and it's being appreciated. Also, things we changed, of course, we did not lift the 2-week isolation period requirement for travelers returning from Eastern Canada. There had been thought about lifting that. At this time, we don't believe it's the time for it. We didn't change the 30% maximum occupancy when it came to religious gatherings and cultural events, but we did remove the need for those partitions or the cohorting. So we believe that is being appreciated by groups as well. And as we've said, public health will continue to monitor, and we'll continue to work hard to understand what's necessary and what are the best steps that we can take, always with the focus of keeping Manitobans safe. That is in the center of our thinking every single day. So it's that continued Manitoba balanced approach that the Premier continues to talk about, that balance between keeping people safe and then moving to reopen things and get back to normal, whatever that normal looks like these days. So let me wrap up. Just a few other things to note. I think when we're into this summer period, we know that there is that effect of COVID-19 that everyone deals with every day. Visibly, we see masks, we see people distancing, but there's also that residual effect on our psyches and on our mental health, and that is very, very real as well. And so we're pleased to report that almost 3,000 people have so far signed up for that free digital mental health virtual therapy program that we put into effect in the spring. We're pleased to see people availing themselves of this opportunity. We were the first province to sign on the dotted line to be able to bring this capacity to Manitobans, and we believe it's helping. And so if you need that help, if you are someone who is just recognizing that in yourself there may be things you want to get addressed in that way, or just to talk through with somebody, go to manitoba.ca/COVID-19 to get more information. We are all dealing with COVID-19. There's no one who is unaffected by COVID-19. We will continue to overcome this thing as we work together and as we care for our neighbors, like our family and friends. On va continuer à lutter contre la COVID-19 si on continue à travailler ensemble et à prendre soin de notre voisin comme notre famille et nos amis. And at this point in time, I will turn things over to Lanette Siragusa.
Thank you very much. Good afternoon. Public health officials advised today that the 5-day test positivity rate is currently at 0.46%. There are 2 new cases to report as of 9 a.m. today, bringing our overall number for the long weekend to 27 cases. Grand total since we began is 442 COVID cases and 93 which are currently active right now. Over the weekend, of those 27 cases, 12 were identified in the Southern Health Saint-Sud region, 10 cases were in Prairie Mountain Health, 3 were in the Winnipeg Regional Health Authority, and 2 were from Interlake Eastern Health Authority. One of the cases that was reported on Monday has since been removed as it had already been counted, so it was double counted. Case investigation is ongoing. And I can tell you, as the minister had said, the majority of these cases are either travel related or known contacts within a household. Other cases continue to be investigated, and information will be provided as needed to make sure that the public is aware of any public health risks. The data also shows that 9 people are currently in hospital, including 4 who are in the intensive care unit. As I said, there's 94 active cases, 341 have recovered from the virus, and the number of deaths due to COVID-19 remains at 8. So also the minister touched on the number of lab tests that were done over the weekend. So in total, there was 5,281 lab tests performed since Friday. So that includes 1,803 on Friday, 1,354 on Saturday, 1,090 on Sunday, and 1,034 on Monday. The total number of tests that have been completed since early February now sits at 93,995. The testing sites, we continue to encourage anyone who's experiencing symptoms to go get tested at a COVID testing site. New facilities are open. Temporary testing sites will remain open in Russell and Killarney this week. In Killarney, the testing site is in the parking lot at the Tri-Lake Health Center, and it's open Tuesday to Thursday this week from 10 a.m. to 2 p.m. as well as a drive-through testing site in Russell at the EMS building is open tomorrow and Thursday from 10 o'clock till 2 o'clock. And I would encourage all Manitobans, if you want to get tested, to go to the manitoba.ca/COVID-19 website and just make sure that you know where you're going and the hours of operation. They're all available to you online. And so I think with that, I will close off. We can open up to questions, and I think we're going to start on the phone lines, and we can move to in-person after that.
Thank you, Lanette. Yes, we go to the phone first today from CBC Radio Canada. Gavin.
Hi, this is a question for Madame Siragusa. I'm wondering if you can give us an exact number on the amount of cases that are community transmission, say in the 27 cases announced over the long weekend.
The report we got from the public health officials prior to the presser today was that all of them had been accounted for in terms of they were travel related or close contact of households. There are a couple that still need more investigation and follow-up, but to our knowledge, the 27 cases are not linked to an unknown community spread.
This question could be for either of you, I guess. We're seeing more and more cases in the Prairie Mountain health region. Does public health or the minister know if this increase in cases in that western region of Manitoba is related to the relaxation of travel rules into Western Canada?
Well, we do know some of them are travel related. I don't have that information at my fingertips here, but we do know that they are travel related. So I would say, part of it is making sure that Manitobans understand the risk of travel, the risk of close contacts, and be aware and cognizant and careful, take the necessary precautions.
Yeah, and I would just add the following, that, Dr. Friesen has continued to be clear that with every measure that we lift, there is, some degree of risk introduced, and our success will rely on our continued willingness to do the right things, and then to be able to identify, to do tests robustly, to send people home when they are sick. So success in all of this doesn't mean the absence of COVID-19 cases being identified. Success will look at like our ability to find and locate, and then to do that that examination of who they might have been in contact with, and then to be able to send those people into isolation to keep others safe.
From CTV Winnipeg, John.
Hello, this is a question for Minister Friesen. We understand that Manitoba Liquor Mart employees are now required to wear non-medical masks when they're working. Can you tell us a little bit about the philosophy behind this?
So I can't speak for the corporation. This is the first that I've heard of a decision that those employees would, while at work, be wearing masks. I can tell you that we've continued to say in Manitobans that some people are wearing masks, and other people are choosing at this point not to. I would always relate people back to the evidence, which is that, Lanette Siragusa just shared with us today that our case positivity rate remains at 0.46%. And, while any case is one case too many, that's an enviable number depending on where you are in North America right now. So at this point in time, Brent Friesen has continued to say that, we don't know the future. We don't know what we'll be faced with in September or November or February. But at this point in time, we have not moved to require masks in any way. The most important things we can continue to do is to respect that distance and wash hands. And then I know that our Chief Provincial Public Health Officer has also said, but masks could be useful when you're not able to maintain social distancing.
In regards to the Steinbeck sort of concerns that happened over the weekend. Should people draw the conclusion, or do you understand how some people may draw the conclusion that it is becoming less safe to go and mix in the community? And what sorts of measures can be taken to assuage those concerns sooner, especially when you have, large clusters or large numbers of cases being communicated?
So thank you for the question. I think information is key. If people are thinking that these are two unique, unrelated cases that just incidentally popped up on the same weekend at two different restaurants, yeah, that causes concern. But what we're reporting today is, in fact, those cases are linked, that there is one household involved, that the key consideration was the importation of the virus into the jurisdiction through travel, which has been the case in other instances as well. So I think that will help people to understand that this is, it's been linked. People are doing the right things. Public health did their job. The contact tracing was successful. The people involved have gone home to self-isolate, and they are being monitored. And I think that should give people a lot more comfort in terms of their decision today of whether they want to move around or not. And I think that today we had heard some reports anecdotally that some businesses had not opened. A few businesses had chosen to close their door. And while that is, it's always up to the proprietor and the business to know how they are going to independently act. There is no recommendation today from public health, no recommendation from the minister that they should be closed. When it comes to these cases, they're linked, they're related, it's one household, and in the words of Brent Rusin, we need to learn how to live with COVID-19.
From City News, Jonas.
Good afternoon, folks. Just going to follow up on that Steinbach one. I think a lot of folks will be looking at restaurants and concerned it was maybe front of house, or somebody dealing with customers. Is that the case, or can we assure them that there wasn't a lot of interaction?
These were known contacts, so they were aware and following all the precautions that they needed to. They were asymptomatic, and so I think in terms of were they dealing with customers, I'm pretty sure one of them was not, and I'm not sure about the second one, but I know that they followed all the right steps to take, and the risk is fairly low that other people would have been infected with COVID at that time. I would say, though, just in follow-up to the minister's questions, there should be some reassurance that these were travel-related, close contacts in one household, but it does make you think as a citizen that you do have to be cognizant of it's not the same as it used to be. We do have to keep that distance. We do have to wash our hands frequently. We shouldn't be going out if we are sick. And masks, non-medical masks, if you can't maintain that distance, especially inside. So I think in terms of those Steinbach cases, they did everything they were supposed to, and the risk at this point is fairly low.
Thank you for that. And just to get a follow-up, last week there was some discussion about possibly reinstating travel bans from Western Canada, or reinstating self-isolations, I should say, not bans. Any further discussion on that after the jump this weekend, or I guess considering that we do know where the cases come from, are you confident that we can proceed as we are now?
We continue to monitor. We continue to watch what the levels are. Our case positivity rate remains relatively low compared to other jurisdictions, but of course we're concerned when we see an increase in other jurisdictions. So I would say there's nothing new to report at this point in time. As you know, we chose not to implement on releasing those self-isolation guidelines for Eastern Canada in our last phase we entered into, and we'll continue to monitor.
From Global, Amber.
Hi, so I'm just clarifying something. The Steinbach cases, were they all linked to one individual family then?
That's correct.
Okay. And I kind of a math follow-up question. Other provinces are looking to make masks mandatory for students in schools and teachers. Is that something that is going to be considered here in Manitoba as well?
Well, certainly I would say in answer to your question, has there been consideration given? Absolutely. We're giving consideration to a lot of variables. I know that just toward the end of last week, the Minister of Education and the Chief Provincial Public Health Officer held a presser to update Manitobans on the plan for reopening schools. That's a robust plan with the collaboration of all school divisions and the input from those groups. And there's more to say. We still remain some weeks away from the opening of schools. So I would say that the evidence of what we see between now and then will be important for helping to inform decisions. But at this point in time, we know that there's an appetite from families for things to get back to how they were in schools, and then we'll proceed in a way that we think best keeps students and teachers and staff safe as we look to get children back into the classroom.
From the Brandon Sun, Colin. From the Brandon Sun, Colin.
Sorry about that. My question is regarding a couple of what looks like discrepancies in the data about total cases. The number of cases the minister announced at the beginning of the conference per day over the long weekend were not the same number of daily cases as was released in the daily updates over those days. And the number of cases on the dashboard on the province's website also do not match up with what was announced via email or via the province's Twitter account for the past few days, as well as for the total number of cases in Prairie Mountain Health. The press release says there have been 10 new cases, but the number of cases has gone up by 11. I was wondering why the numbers are differing from what is online versus what is being presented in press releases versus what is being said during today's conference.
Yeah, that's a good question. So the numbers that I provided, 10 in Prairie Mountain and 27 cases over the weekend, is the most accurate. And the discrepancy was related to postal codes and where people actually live in which region. So as the public health follow-up happens, we get more clarity on who's where and can assign it to the appropriate region.
But then I'm also curious about, we received, I believe it was tweeted on Sunday that there were 18 new cases, but on the dashboard it listed there were only 6 new cases discovered. I'm wondering why those numbers are different as well.
So the 18 cases were attributed to Saturday and then 6 cases on Sunday, and so there might have been some discrepancy about when those numbers were reported by press, but those numbers, as we said, and then trickling up to that total case number of 27 over the last 3 days is the most accurate and up-to-date information we have. But keep in mind, too, that as Lanette Siragusa said, sometimes we'll report by RHA and then we find out during the public health tracing that there's a postal code that belonged in a different RHA. So those things sometimes need to be ironed out a bit, and they get ironed out over time.
Thank you, Minister. We now go to the floor in room 68. Please proceed.
Still, on that note, you announced 7 yesterday. Now you're saying yesterday was 5. You take one off, there's still one unaccounted for. And today, in your press release, and you yourself, you say we have 442 total cases. The dashboard online says 443. So which is it?
So these were just updated just 15 minutes prior to coming in. So the dashboard will be updated as well accordingly. And it is just part of the public health process, the contact tracing and the investigation and the conversations with the people who are identified, so that we can provide you with the most accurate information as it comes available to us.
completely different tack. Dr. Tam now says that she's recommending that, this is for you, Minister Friesen, that children over 10 wear masks in school. That's Dr. Tam federally. She said it's one of the numerous things schools could do to spread COVID-19. Says it only plays a role in reducing transmission. She also says the other ways to reduce it are keeping students in group that minimize contact and hygiene. So now that we have the federal government recommending students age 10 and over, what changes will that have for the school year in your mind? Or how will you consider this information?
Well, the information is under consideration, and as we said just last week, towards the end of the week, the Minister of Education and the Chief Provincial Public Health Officer were in this room providing Manitobans that update to say that there is a plan to return students to school. There is a plan to keep them safe, to try to the best of our ability to cohort groups in exactly the manner that Dr. Tam has described. Brent Rusin has regular and frequent contact with the Public Health Agency of Canada, with Dr. Tam, with the federal government, with his counterparts in other agencies. And so we know that there are some provinces at this time saying that they will proceed with masks in September. Other provinces have said they are not there yet. And as I said, we have still a number of chapters to write in terms of the weeks that lead up to the start of class. Certainly, many things are on the table. Many things are under discussion at this time.
Ms. Siragusa, do you know how many of the ICU cases are linked to clusters?
Not off the top of my head.
And same with number of hospital patients. Are they mainly related to clusters, or?
I would have to look into that. I don't have that on my fingertips,
The
Larry.
eighth person who died, we never heard whether that person had underlying health conditions. Do you know that?
I can find out for you.
Okay. And so if, we were just wondering also if that person was linked, the eighth death was linked to people who are in ICU.
The eighth death,
Yeah.
I believe, was not in ICU.
No, but was that person linked to
Oh.
people now in ICU?
Okay, I can look into that.
With the big spike in numbers, are those related to clusters that were talked about previously, or are these all new kind of clusters or groups that have popped up?
They are related to existing clusters, some of them, and some of them are new travel-related clusters.
With all these increases in numbers, with the people who are coming down with COVID-19 or testing positive for COVID-19, were they previously following public health orders? Because you go in the community and there's quite a bit of anecdotal evidence about people not wearing masks or socially distancing and all these other things. Are we seeing a lot of people who are not socially distancing and following these public health orders who are coming down with COVID-19?
Are you specifically talking about those in clusters?
I'm talking about any of the cases that, are we seeing more evidence of people not following these public health orders and coming down with COVID-19?
Yeah, well, I would say for those people who are identified within a cluster, that public health has been in close contact with them. They have been very supportive and working collaboratively to minimize the spread within the cluster. And I actually want to give a shout out of thanks to the people who have been tested positive for COVID. They are very good informants in terms of where are their close contacts, who have they been in contact with, so that it makes the job of the public health officers much easier, the nurses as well, to identify where the pathway, the investigation. So Manitobans have done an excellent job with that. I think there are, some cases, obviously, COVID it's no one's fault that you get it. It's a very contagious virus. And so people, sometimes the guard is down. Sometimes you are in a situation where you're in closer contact than you intended to be. So it could happen, absolutely. But the indications that we're getting from public health is that people, these are travel related, they're contact related, they're often household related, and when it's identified, they are compliant, and people are, for the most part, aware of what they need to do in terms of monitoring and isolating.
When you say cases are travel related, could you define that? Are you talking truckers? Are you talking people traveling back from Western Canada? Can you be specific on what you mean when a lot of these new cases are travel related?
It could be any of the above. So it could be people coming from Western Canada, it could be essential workers, it could be a whole host of people still need to travel. But those people, for the most part, are aware of the risk and compliant with the expectations. It doesn't mean they won't get COVID, though.
Today you said there were 93 cases. In the press release it says 94. Has that been updated, or?
I think 94 is the right. Do you have the press release in front of you?
I believe it said 94 in the press
94,
release.
sorry.
Okay.
That was my math.
So of the active cases, of the 94 active cases, I know it's a sensitive issue, but could you ballpark what percentage of these may come from Hutterite colonies?
I cannot.
What, a lot of them?
Some of them may come from Hutterite colonies, but I don't have that information available to me.
I guess the question is also that we want to know is that the travel related to the inter-household related. At what point does it turn over to that? So if you had someone travel from somewhere, came back, let's say they have a cluster of people that they live with, they have a bunch of people that they live with, when does it turn over to household contact at that point? Is it still considered travel related? So the first people that came in was travel,
Right.
and then everyone else is household, is that correct?
Yeah, or close contact,
Or
yeah.
close contact, okay.
Yeah.
And so at this point, you're saying that over the weekend, a lot of them were those type of situations,
Yeah.
Not community transmission.
Correct.
Because we're trying to figure out, it's not just out in the public when you see these numbers. I think that's what's alarming to people.
Yeah.
So if you could maybe touch on that a little bit, just reiterate it again, that would be good for us.
Yeah, just from what we know, and the investigation is ongoing, there's still a few that we have to follow up on. But from what we know, the cases have been either from known clusters or travel related. And for the person who travels, they know the risk, they know what they need to do, and they know that in their household there's a risk related to those people as well. So trying to keep your distance as much as possible while staying in the same household. So those are the type of cases that we're seeing, that we saw over the weekend. So it's not indicative of community spread at this point. And if there is, we absolutely will be letting the public know, and if there's any risk, we will be identifying that.
But of the 94 cases right now, though, how many active cases, how many of them are due to community pop-up risk?
Well, I'm specifically speaking to the ones that came this weekend, and I can follow up on the ones before that include the entire 94 cases.
So again, you're saying all 27 this weekend are known cluster?
The majority of,
I
there's still,
can speak to that as well
Yeah.
and say the most recent information that I got was that all but 2 of the cases reported this weekend were attributable to travel or household or known contacts. So actually I think that's one of the highest rates we have seen thus far of any length of days when it comes to the number of cases that can be directly explained away through travel or close contact, household contact. So we have confidence. What that should demonstrate to Manitobans is that this continues to be a risk at this point in time more due to the fact that there may be people coming here from other places. Part of that is just the acceptable risk we must have knowing that our supply chains remain open. What is important is how those cases are managed, and we have a high degree of confidence that public health is doing their job, Manitobans are doing their job, they are reporting who they've been in close contact with, and that is helping us to isolate the right people.
My question is about communication then. I think when you see this here in Manitoba, a spike again of 18 on one day and another on another day, but we don't have a briefing to talk to you about, we don't have questions we can answer and get back. We kind of just have the numbers and we have to report it out to everybody. So our question is, are we going to be going back to a minimum of 2 briefings or potentially more per week now that the numbers are higher? Because this explanation was great, but we didn't have it over the weekend, so there was a lot of speculation. So people that are traveling on a long weekend or a summer day are worried potentially when they see that spike. But explaining it makes sense. So are we going to be going back up as our numbers potentially are higher? Could we go back to more briefings?
The short answer is yes, and I accept the question. This has always been, we're trying to get this right, and we're trying to respect the need for people to have a little bit of time, point in time, like you say, when you have a significant number on a day like that. It's much better if it comes with an explanation. So no, we're not briefing per week basis, and I know that in the discussions that happened today, we'll be rethinking what it would take to flex up to more briefings, and we want to be accountable to Manitobans the best way we can, and having good information on a prompt basis is one good way to do that.
If not a briefing, a detailed press release perhaps, so it could have given us a lot more information instead of the media over the weekend relying on reports coming from private businesses for information.
It's fair comment.
I have a question about, we're hearing complaints, and Dr. Friesen raised it last week, although we didn't get a chance to question him on it, about complaints on test turnaround times. We're hearing like 3-4 days for returns on results. Dr. Friesen volunteered information saying that there had been complaints, it had become an issue. What is the issue, and is Dynacare part of the issue in terms of notifying? Can you comment on any recent delays in testing and test results?
Yeah, so as you know, throughout this last few months, there are sometimes inherent delays from when you get tested to when it gets to the lab. Sometimes it's just a distance issue, so that can be a bit of a delay of a couple of days. The lab itself is doing a fantastic job turning over the results as soon as they get them, reporting them within 24 hours. So that, I think, quite well from that part of it.
The website then, or?
Well, yeah, it's partly there's a website and there's a call-in number where you can call into HealthLink. So I guess I would say the number one thing is if we receive a positive COVID test, public health gets on that right away. There is no delay. They call, they start the conversation, they start the investigation right away. For those who are negative, we have experienced some delays. I appreciate that, and we are working towards what a better solution would be. Right now, I understand the wait on the calls to HealthLinks is about 20 minutes if on a busy time, less so if it's not. Dynacare is a consideration that we are exploring, and they may help the process overall, and same with, we have provincial labs as well within Shared Health that we can try and support.
On that note, has Dynacare stopped sending samples to Brampton, Ontario as planned as of Wednesday?
I can get back to you with that. I know that now all of the equipment that they were marshaling to Manitoba is here. It is commissioned, it is operable, and is functioning well is my most recent information. So now whether there would be any need to send samples beyond our borders, I would think not, but I'm happy to follow up and confirm that with you.
And one more schools question. Dr. Tam also said today that learning more about kids' transmission. They're saying that maybe actually kids spread a lot more than we thought. Now, the science isn't clear there yet, to be fair, but she's also saying that they're looking at the role of ventilation and potentially encouraging schools to open windows. Have you digested that information yet?
Well, you know, when I said there's a lot that is under consideration in advance of the reopening of schools in September, those things are among them. I can even tell you that when it's come to the initiative that we've undertaken to try to create a more like a semi-permanent solution or an interim solution for personal care homes and long-term care facilities, even there ventilation has become an important discussion point. So it's understandable to me that this would become part of the discussion when it comes to schools. I would say this, though, like, we know that there are robust efforts in place right now that are going to think about how we can separate students, and then how we can cohort them, and how we can encourage them to have good, hand washing technique, and to remain, outside of that 2-meter distance. I think the more significant efforts, but as the evidence continues to come in and as research continues to report, those will all be things that provinces and public health officials and ministers of health and governments are thinking about.
Time for a couple more, guys.
Okay, so this is just a question about, we've seen some pictures over the weekend, establishments looking like there's no physical distancing happening in there. There's one establishment that has been in the news a couple of times. At what point are we is the province looking to up fines or looking to pull liquor licenses or get something going to say, like, this cannot happen kind of thing?
So the first line of defense is just awareness and education. I know in the situations, if there's complaints or concerns raised, that public health will reach out to those individual businesses. Fines may be given, and escalation protocols are in place or would be available if need be. All of which you say, the liquor license and higher cost fines.
So when we're at the escalation part of it, can you kind of break down what could possibly happen to a business? Because I know you said fines, but then what's our escalation at that point?
Well, I think we'd start with the beginning step, and then the fines would escalate in terms of the amount required, and then it would really be up to public health to determine what are the next steps if that's not an effective way.
Compliance is important. Enforcement has its place, but the goodwill of Manitobans is so important, and we won't be able to enforce our way into a good outcome. So I agree with Lanette Siragusa wholeheartedly that we have to begin with an education approach. And I think it's important to have the facts and to know that in the vast majority of cases, it's been my experience that proprietors, business owners are working very, very hard to comply. And then where there's evidence to the contrary, obviously there's a role. In this case, like you mentioned, the LGCA is responsible to investigate and then to enforce. But we know that the biggest lever that we have to mitigate towards success on this is compliance.
One of those businesses made a joke on Facebook today about it.
One of the businesses made a joke?
One of the businesses that was in the media. I'm looking for the Facebook post. It essentially joked that their special or pizza wasn't fatal. Anyway, we see a lot of cases outside of Winnipeg. I know cases aren't everything. Positivity rate's what you want us to all focus on as in part of your message track. I gotta ask, big picture for either of you. Initially, these cases were all Winnipeg, and people outside were going, yeah, that's a Winnipeg thing. Just like the homicide. Now, are people outside of Winnipeg taking COVID-19 seriously enough, in your opinions?
Well, I'm going to let Lanette give her own response, but I will respond to that. First of all, anecdotally, I'm not going to really venture in there because it's difficult to take the temperature test of all Manitobans in that way. Anecdotally, I think that people get it, that this is here for some time and that it affects all of us. Maybe, as you say, it was the increase of cases beyond the perimeter that got people scratching their heads and saying, okay, I think this is closer to home than we thought. However, I think that I would also want to point out, and it's been said from this microphone before, that we're working on a coordinated way to change how we respond both up and down on COVID-19 as we go forward. So clearly accepting that COVID-19 is going to be with us throughout this next influenza season, there's no vaccine yet in place, then we need to understand that we need to have a more nuanced approach when it comes to managing. And so to your point, if we have something happen in a southwest part of Manitoba, it should not necessitate in time that we close the northeast part of Manitoba. And so we're working on an ability, a series of red light, green light steps that would measure our response in a more evidenced, systematic way to be able to make decisions to, allow people to move around the economy appropriately, or move around their communities appropriately, but to do so in a way that keeps their safety first and foremost.
So you're saying you're talking about changing pandemic restrictions on the basis of region. How fine granular would you be talking about?
So that's the questions that are needing to be hammered out. How refined would that ability be? But those efforts are underway right now. We've seen other provinces take those steps. We've seen other provinces move to enforce some restrictions in parts of their jurisdiction and not in others. We certainly saw that approach regionally in Ontario, so that thinking is also resonating with us. There's more in our plan, but we're hoping to update Manitobans quite soon on our ability to go forward with COVID-19 on that basis of evidence and regional decision-making.
The 3 most recent cases in Winnipeg, any of them, or were 2 of them likely community spread or possibly community spread?
Not that I'm aware of. Yeah.
So they were travel or?
That's
known
correct.
cases?
So of those cases, the majority are travel or close contacts, and we have not been told over the weekend that we have any indication of community spread, but there are 2 more that we have to investigate.
And the 3 cases in Winnipeg, no reason to believe they're community spread at this point?
Correct.
I have a clarification on the Steinbach thing. Just yesterday, we kind of reached out to a couple of places. So we had information that there was employees at 2 restaurants that tested positive, and then there was an employee at another business that tested positive. So that was 3. That was just there with, like, I guess, business related, let's say. And then with that, one person working at a restaurant, their family member had got it as well. So that was kind of the trigger point. So I think when my colleague was asking about how many in Steinbach were related to Steinbach, you said 2. So I just wanted to clarify if it was 3 people. So 2 to the restaurants, is that what we're saying?
So yes, there were those 2 reports of restaurant-related employees. The third one that you referenced, I'm aware of as well. And there, a Steinbach business had indicated that one of their workforce had earlier tested positive for COVID-19. That was not a weekend event. I actually believe that they had indicated in that case that the individual's last day of work had been about a week prior to this. So not concurrent, but sequential.
Okay, perfect, thank you.
And I just want to go back to the very significant thing that you just said. Ontario has for some time applied different pandemic restrictions to different regions. For example, Kenora could have restaurant service on patios before such a thing would be contemplated in downtown Toronto. When will Manitoba then start applying pandemic restrictions to different geographic areas in a different manner based on risk?
Right, so exactly as I told you right now, that is exactly the work, one significant work stream that is underway. I hope to have an update to Manitobans soon on how we would proceed down that path. But it's part of our Engage Manitoba Reopen strategy to make sure that we are putting health and safety of Manitobans first and foremost, but then still taking an evidence-based approach. We heard in the past, even while all of the world was struggling to know how to respond to COVID-19, we heard those concerns about closing this part down when there seemed to be no evidence of COVID in that part. And we believe that we can balance that need of keeping safety in the center with still allowing people to move around their communities, move around to their schools and their workplaces as the evidence supports it, and we'll have more to report shortly.
Thanks, everyone. Thanks, everyone. Thank you very much.
Thank you.